Welcome back to the Delaware Way. There has been some controversy and confusion over immunization and what shots do you give your child? Should you separate the shots? Should you get them immunized at all? Here to help clear up some of that confusion is Dr. Karyl Rattay from the Division of Public Health. Thank you so much for coming back.
Thank you for having me.
And congratulations, you received an award on this very topic.
Yes, we did. So we're really proud of the progress that Delaware has made as far as vaccination rates. So Healthy People 2020 is a set of national goals, and Delaware received 3 separate Healthy People 2020 awards recently for progress that we're making.
I want to talk about the presidential campaign, though, because vaccines came up during the presidential campaign, and there was continued confusion, and it all seems to be based on a report that has been discredited that certain immunization shots can cause autism. And yet, there are some people that were running for federal office that still thought that was a possibility. Can you talk about that and the lay fears?
Yeah, and thank you for asking about that because, unfortunately, immunizations have been the subject of fake news stories for many years. The study connecting the measles, mumps, and rubella vaccine to autism has been completely debunked. Vaccines are safe, they are effective, they are not connected to autism.
And yet there are people that still believe that because the study at the time that was done in Britain, right, in Great Britain, the study at the time got so much publicity and it seemed to be legitimate. And it's been able to hold on even though group after group after group. I think the people had to give up their medical license that did the study.
Yeah, that is correct. You know, I can't really understand how it all evolved, but I know that for those struggling with autism, you know, it's very, very challenging, and I think people wanted an answer.
Yeah,
we just haven't found the answers yet.
Is it wise to separate those shots? That's what a lot of people are saying, that they don't like the mercury that holds it together and they want to separate those shots, even though, have they taken the mercury out of that?
There's very, very limited amounts of mercury in a couple of the vaccines. I understand that that is a concern for some people, but the reality is it's really better to just get them over with. The body's immune system reacts well in doing it that way, and you're protecting a child more quickly.
These things are studied, they're put through FDA testing, and then they're finally approved and on the market, and then you have people that just don't trust what you're telling them, what health officials are telling them.
You know, it's interesting. So if you look back over the last century, you know, this is without a doubt one of our greatest health achievements in the 20th century. And so you think about infections like polio, which killed and paralyzed many people, smallpox, which we really don't even see, even German measles, rubella in the 60s, millions of people became ill, thousands died. We rarely see it anymore.
I just had a discussion with parents who said they're not going to have their child get the HPV shot because they said that my child's not going to need that. Explain why it's necessary.
Yeah, so HPV, human papillomavirus, is the most common sexually transmitted infection. Many people, it's a very high percentage of individuals who get HPV in their lifetime. And it is a very common cause, in fact, the most common cause of cervical cancer, throat cancer, other kinds of cancer, and it is completely preventable now. So HPV vaccine, now it can be administered in 2 doses. It is extremely safe, extremely effective. And I know that a lot of parents think, well, it's those other kids that are going to get this virus and not mine. But the reality is any kid is at risk, or any, I should say, individual who is sexually active is at risk. And we don't want to think of our children in those ways, but the reality is, it's at some point it's very likely they'll be exposed.
You're doing them a favor for later in life.
Right. We don't want them to get these kinds of preventable cancers, and we can prevent it by having them just get the HPV vaccine.
Wonderful. Thank you so much.
Thank you so much.
Dr. Karyl Rattay from the Division of Public Health. When we come back, this is Gambling Awareness Month. We'll tell you what you need to know when the Delaware Way continues.